whooping cough, also known as pertussis. So it is a highly communicable acute bacterial disease of childhood, and it is caused by Bordetella pertussis. The use of DPT vaccine reduced the prevalence of the whooping cough. So whooping cough is also known as pertussis. It is a highly communicable acute bacterial disease of childhood and caused by Bordetella pertussis. So DPT vaccine reduces the prevalence of the whooping cough. Next, moving on to morphology. Bordetella pertussis is a small ovoid coccobacillus. In primary culture, cells are uniform size and shape, but on subculture they may become large and thread-like. Mainly, we have to remember that it is non-motile and non-sporing, but it have capsule, but tends to lose the capsule on repeated cultivation. If we use in a repeated culture, then it is losing the capsule. So the capsule can be demonstrated the special stains, but does not swell in the presence of the antiserum. And if the culture, bacilli tend to be arranged in loose clumps with clear spaces in between, giving a thumbprint appearance. So it is very, very important, thumbprint appearance. It is in culture, Bordetella pertussis seen in thumbprint appearance. So freshly isolated strains of Bordetella pertussis have fimbriae, and it is a gram-negative bacilli, and bipolar metachromatic granules may be demonstrated on staining with toluidine blue. Bipolar metachromatic granules may be demonstrated on staining with toluidine blue. So here the important point is it is non-motile, non-sporing and have capsule, and in culture it is present as a thumbprint appearance and have fimbriae, fresh culture, and it is gram-negative. Bipolar metachromatic granules are present. Next, moving on to culture. It is an obligate aerobe, that is, it does not grow on anaerobical condition. It grows best at 35 to 36 degree Celsius. Complex media are necessary for primary isolation. The medium, it has the special medium for the growth of this Bordetella pertussis, that is Bordet Genova glycerine potato blood agar or Regan Lowy media. So it is very important, we have to remember this special medium for this organism, and blood is required not to provide additional nutritive factors, and charcoal blood agar is the useful medium. It does not grow on simple media like nutritive agar. So it is does not grow on nutritive agar, and in charcoal blood agar also useful, and bisected peels or mercury appearance are also seen. So growth is very slow. After incubation for 48 to 72 hours, colonies of the Bordet Genova medium are small, dome-shaped, small, opaque, viscid, grayish-white, refractile and glistening, resembling bisected pearls or mercury drops. It is very important, that is bisected pearls and mercury drops. Next point is confluent growth, that is present as an aluminium paint appearance. So confluent growth present as an aluminium paint appearance. So bisected pearls or mercury drops appearance on the Bordet Genova medium. So these are the important point. And next, moving on to biochemical reaction, it is biochemically inactive, does not ferment sugars. So it is its form indole and reduce nitrates. Utilize citrate or split urea. It produces oxidase and usually catalase also. So these are the important biochemical reaction. Biochemically, normally it is very inactive and it does not ferment sugars. It is important. It is form indole and reduce nitrates. Utilize citrate or split urea. It produces oxidase and usually catalase also. So these are the biochemical reaction. In culture media, the special culture medium for the organism is very, very important. So these are the important point in this picture showing the growth of Bordetella pertussis on Regan Lowy media. This is how the growth appear in the culture medium. And next, moving on to resistance, it is a delicate organism being killed by heat, drying and disinfectant. In heat, it requires 55 degrees Celsius for 30 minutes, and it retains viability at low temperature, that is 0 to 4 degrees Celsius. And outside the body, Bordetella pertussis is present as a dried droplets and is said to be survived for 5 days on glass, 3 days on cloth and few hours on paper. It is very important. So it requires 55 degrees Celsius for 30 minutes, and drying and disinfectant kill the organism. Retains viability at low temperature, that is 0 to 4 degree Celsius. Next, moving on to virulence factor. There is a lot of virulence factors for Bordetella pertussis. First one is agglutinogens. Bordetella carries surface agglutinogens associated with fimbriae. It is classified into 1, 2 and 3 types. It is essential for pertussis vaccine strain containing factors 1, 2, 3. Factor specific antibodies are present in the sera of convalescent and immunized persons. So next, moving on to pertussis toxin. What is pertussis toxin? It is also called PT. So this is present only in the Bordetella pertussis. So it plays an important role in the pathogenesis of whooping cough. So PT is expressed on the surface of the bacillus and secreted into the surrounding medium. The toxin exhibit diverse biological and biochemical activities. So here the pertussis toxin plays an important role in the whooping cough. It is very important. And it has the examples are this toxins are lymphocytosis producing factor, that is LPF, histamine sensitizing factor, that is HSF, and islet activating protein, IAP. These are the examples for pertussis toxin. In lymphocytosis producing factor causing found lymphocytosis in pertussis patient as well as in experimental animals. So it is very important diagnostic feature is lymphocytosis is present in pertussis patient, and histamine sensitizing factor is responsible for heightened sensitivity to histamine in experimental animals. So there is a increased sensitivity to histamine, and islet activating protein indicating excessive insulin secretion by the pancreatic islets. So these are the 3 examples for pertussis toxin. Next virulence factor is filamentous heme agglutinin. So this is one of the 3 heme agglutinin producing by Bordetella pertussis, the others being PT and the lipid factor. So it promotes the secondary infection by coating other bacteria such as Haemophilus influenzae and pneumoniae. So others virulence factors are pertactin, adenyl cyclase, heat labile toxin, that is HLT, and tracheal cytotoxin, that is TCT, and lipopolysaccharides. These are the virulence factors present in the pertussis. So agglutinogens and pertussis toxin, it is very important, that is PT. Examples of PT and filamentous heme agglutination, pertactin, adenyl cyclase, heat labile toxin, tracheal cytotoxin, and lipopolysaccharides are the virulence factor for Bordetella pertussis. For pertussis vaccination preparation, we use pertussis toxin. It is very important. Pathogenicity, it is an obligate human parasite. It is responsible for whooping cough or pertussis in human. Its incubation period is 1 to 2 weeks. So it is very important. Incubation period of Bordetella pertussis is 1 to 2 weeks. So it has 3 stages. First one is catarrhal, paroxysmal and convalescent stages, each lasting approximately 2 weeks. So the 3 stages are important. So let's see about each stage elaborately. So first one is catarrhal stage. In catarrhal stage, The onset is insidious with low-grade fever, catarrhal symptoms and dry, irritating cough. So here low-grade fever, dry and irritating cough. So in clinical diagnosis, this stage is very difficult to identify because the symptoms are very mild. And this stage is disease arrested by antibiotics. And the maximum infectivity is present in this stage. So catarrhal stage is having maximum infectivity. This stage is arrested by antibiotics. Next, moving on to second stage, that is paroxysmal stage, cough increase in intensity. So here the intensity of the cough is increased and comes on in distinctive bouts. So patient experiences violent spasm of continuous coughing followed by a longing rush of air into the almost empty lungs. So it is called whoop. It is called whooping cough. So this is the reason behind the whooping cough. So violent spasm of continuous coughing followed by a longing rush of air into the almost empty lungs. This is the symptoms in paroxysmal stage. So next, moving on to third stage, that is convalescent stage. Here the frequency and severity of the coughing gradually decrease. So in second stage it increases intensity. In third stage the frequency and severity of the coughing gradually decreases. So the disease usually lasts for 6 to 8 weeks. Almost 6 to 8 weeks the disease is usually last. Next, moving on to the complications. Due to pressure effects during violent bouts of coughing producing subconjunctival hemorrhage, subcutaneous emphysema. Due to the pressure effect because of the vigorous coughing, subconjunctival hemorrhage and subcutaneous emphysema. And second complication is respiratory, that is bronchopneumonia or lung collapse. And neurological symptoms complications is convulsions and coma. So the infection is limited to the respiratory tract and the bacilli not invading the bloodstream. It is very important. The infection limited to the respiratory tract only. So we have to take the swab as a culture or diagnostic feature. So the bacilli not invading the bloodstream. So here the blood or serum is not useful to identify the organism. So the infection is limited only to the respiratory tract. These are the complications produced by the Bordetella pertussis. Next, moving on to etiology. Epidemiology. Whooping cough is predominantly a pediatric disease. So it most commonly in the children. So the incidence and mortality being highest in the first year of life. So it is very important. Pediatric disease and incidence and mortality highest in the first year of life. Maternal antibodies do not seem to give protection against the disease. Immunization should be started early. So secondary attacks rates are highest in close household contact. So the source of infection is the patient in the early stage of the disease. Infection is transmitted by droplets and fomites contaminated with oropharyngeal secretion. Whooping cough is one of the most infectious bacterial diseases and non-immune contact seldom escape the disease. So clinical syndrome resembling whooping cough, that is pseudo whooping cough produced by adenoviruses and Mycoplasma pneumoniae. It produces the resembling whooping cough but not exactly the whooping cough. In laboratory diagnosis, first step is collection and transport of specimen. Respiratory samples can be collected. It is very important. Respiratory samples can be collected by perinasal swab, postnasal swab or using the cough plate method. Some fatty acids present in cotton may inhibit the growth of the bacilli. So we use dacron or calcium alginate swab for specimen collection. So here important point is we doesn't use cotton for swab collection because it inhibits the growth of the bacilli. The swabs are to be plated without delay or transported in a 0.25 to 0.5 ml casamino acid solution. So at pH is 7.2. in modified Schwartz medium or Mistulose charcoal agar. So here the transport medium is modified Schwartz medium or Mistulose charcoal agar. And the pH is 7.2. It is very important. Let's see about individual swab. The first swab is pernasal or nasopharyngeal swab. Here the swab on a flexible nichrome wire is passed along the floor of the nasal cavity and the material is collected from the pharyngeal wall. So here the swab is collected from the pharyngeal wall. So the nasopharyngeal aspirate collected through a soft catheter attached to a syringe is a better source. So it can be used for PCR also. The specimens collected in this manner are the most effective and best suited for diagnostic procedure. So the most effective swab is pernasal or nasopharyngeal swab. The next swab is postnasal or peroral swab. The secretions from the posterior pharyngeal wall are collected with a cotton swab on a bent wire passed through the mouth. Salivary contamination definitely should be avoided and best postnasal swab may be conveniently employed. So in postnasal are also called as peroral swab. It is a second swab. And next third swab method is cough plate method. How do you collect? Here culture plate is held about 10 to 15 centimeter in front of the patient's mouth during a bout of spontaneous or induced coughing so that the droplets of respiratory exudates impinge directly on the medium. So here 10 to 15 centimeter in front of the patient mouth we place the culture plate. So the droplets of respiratory exudates impinge directly on the medium. So this has the advantage that specimens are directly inoculated at the bedside. So these are the three methods of swab collection. So the first one is pernasal or nasopharyngeal swab, and second one is postnasal or peroral swab, and third one is cough plate method. These are the swab collection methods. Here the important point is what is the transport medium for the Bordetella pertussis is modified Schwartz medium or Mistulose charcoal agar. The pH is 7.2. Definitely we don't use cotton because it inhibits the growth of the bacilli. So we use dacron or calcium alginate swabs for specimen collection. So how will you collect from the nasopharyngeal swab and postnasal? In postnasal swab, secretion from the posterior pharyngeal wall are collected with a cotton swab bent wire passed through the mouth. So it is a pre-oral swab and it is cough plate method, placing the culture plate in front of the patient mouth. And then moving on to microscopy. Microscopic diagnosis depends on demonstration of the bacilli in respiratory secretion by fluorescent antibody technique. So here the technique is fluorescent antibody technique. We use this technique for seeing this. The third point is culture. So the medium used here, glycerin, potato, lead agar of Bordet and Genguo or its modification, and another one is Regon lovi with cephalosporin to inhibit the normal upper respiratory flora. So the plates are incubated in high humidity at 35 to 36 degree Celsius. So in high humidity at 35 to 36 degrees Celsius, plates are incubated. Colonies appear in 48 to 72 hours. So the identification is confirmed by microscopy and slide agglutination. So in slide, how will you confirm the growth of the Bordetella pertussis? Here the thumbprint appearance is seen. So the confirmation is by microscopy and slide agglutination. And the next is fourth step is polymerase chain reaction method. It is more sensitive and more commonly used, but In pertussis, it is poor for diagnosis of Bordetella pertussis. It is PCR is not really used. And the fifth method is serology. Serological diagnosis is not helpful and it is not routinely used for diagnosis. And other laboratory parameters, blood changes in the disease are distinctive and helpful in diagnosis. It is very important, that is marked leukocytosis occurs and also lymphocytosis is also occurred. So ESR, that is erythrocyte sedimentation rate, not increased. Except when secondary infection is present, ESR is increased. In primary lesion, in primary condition, ESR is not increased. So lymphocytosis and leukocytosis are present. The total leukocytic count are 20,000 to 30,000 per mm³ with 60 to 80% lymphocytes. And the treatment here is antimicrobial therapy is beneficial only if initiated within the first 10 days of the disease. First stage, that Ketterhill stage, it is very beneficial. And erythromycin is the drug of the choice, and chloramphenicol and cotrimoxazole also useful for the treatment. So erythromycin is the drug of the choice. So antimicrobial therapy is beneficial only in the Ketterhill stage, that is first 10 days of the disease. These are the important points for the treatment. Chloramphenicol and cotrimoxazole are also useful. Next, moving on to prophylaxis, whole cell killed vaccine. First is whole cell killed vaccine, that is pertussis vaccine is usually administered in combination with diphtheria and tetanus toxoid. Is called triple vaccine, that is DPT. D is diphtheria, P is pertussis and T is tetanus toxoid. DPT vaccine, triple vaccine. So high incidence and severity of the disease in newborns, it is advisable to start immunization as early as possible. So because it is most commonly affect the newborns before 1 year. So 3 injections at intervals of 4 to 6 weeks given before the age of 6 months, followed by booster at the end of the first year. This is the schedule for the vaccination. So 3 injections at intervals of 4 to 6 weeks given before the age of 6 months and followed by booster at the end of the first year. So this is the prophylaxis. This picture showing marked peripheral blood lymphocytosis in whooping cough. So this is the important feature in whooping cough. The first question is, thumbprint appearance in culture film smear is seen. Option A, Bacillus anthracis. Option B, Brucella species. Option C, Bordetella pertussis. Option D, Clostridium welchi. So the answer is definitely Bordetella pertussis. The thumbprint appearance is Bordetella pertussis. The second question is, culture medium used for Bordetella pertussis is option A, Wilson Blair medium. Option B, bile broth. Option C, Bordet Jingo medium. Option D, Robertson cooked meat medium. Culture medium for Bordetella pertussis. So the answer is option C, Bordet Jingo medium. The next question number 3 is, all are true about Bordetella pertussis except, so which is false? Option A, most common cause is Bordetella pertussis. Option B, it may occur in children and young adult after vaccination. Option C, bacteria culture from nasopharyngeal swab is the definitive diagnosis. Option D, presence of antibodies in serum is diagnostic of the disease. So the answer is option D, presence of antibodies in the serum is diagnostic of the disease is a false statement.